Rivalida de Medicina de Puerto Rico, 10 common questions on the brain and ventricles. 1. A patient presents with hydrocephalus. What is the most common cause of non-communicating obstructive hydrocephalus? A. Overproduction of cerebrospinal fluid CSF. B. Impaired CSF absorption by the arachnoid granulations. C. Aqueductal stenosis. D. Increased venous pressure in the dural sinuses. Correct answer C. Aqueductal stenosis. Explanation. Non-communicating hydrocephalus occurs when CSF flow is obstructed, most commonly at the cerebral aqueduct of Sylvius, preventing drainage from the third to the fourth ventricle. 2. Which part of the ventricular system is most commonly affected in normal pressure hydrocephalus, NPH? A. Lateral ventricles. B. Third ventricle. C. Fourth ventricle. D. Cerebral aqueduct. Correct answer, A. Lateral ventricles. Explanation. In NPH, there is ventricular enlargement, especially of the lateral ventricles, due to impaired CSF absorption, causing the classic triad: gait disturbance, urinary incontinence, and dementia. 3. A 65-year-old patient with a history of hypertension suddenly develops a severe headache, nausea, and loss of consciousness. A CT scan shows blood in the lateral ventricles. What is the most likely cause? A. Subdural hematoma. B. Epidural hematoma. C. Hypertensive intracerebral hemorrhage. D. Aneurysmal subarachnoid hemorrhage. Correct answer, C. Hypertensive intracerebral hemorrhage. Explanation. Hypertensive hemorrhages commonly occur in the basal ganglia, thalamus, or pons, with intraventricular extension leading to ventricular bleeding. 4. A newborn is diagnosed with Dandy-Walker malformation. Which of the following best describes this condition? A. Absence of the corpus callosum and enlarged lateral ventricles. B. Agenesis of the cerebellar vermis with cystic dilation of the fourth ventricle. C. Failure of the rostral neuropore to close. D. Defective migration of neuronal precursors in the cerebral cortex. B. Agenesis of the cerebellar vermis with cystic dilation of the fourth ventricle. Explanation. Dandy-Walker malformation involves hypoplasia of the cerebellar vermis, enlargement of the fourth ventricle, and posterior fossa cysts, leading to hydrocephalus and motor deficits. 5. Which structure produces cerebrospinal fluid, CSF? A. Arachnoid granulations. B. Ependymal cells of the ventricles. C. Choroid plexus. D. Pia mater. Correct answer, C. Choroid plexus. Explanation. The choroid plexus, located in the lateral third and fourth ventricles, is responsible for CSF production. 6. A patient with a history of metastatic lung cancer develops hydrocephalus due to impaired CSF absorption. Which structure is affected? A. Cerebral aqueduct. B. Choroid plexus. C. Foramen of Monro. D. Arachnoid granulations. Correct answer, D. Arachnoid granulations. Explanation. Communicating hydrocephalus results from impaired CSF absorption at the arachnoid granulations, often due to meningeal carcinomatosis, infections, or subarachnoid hemorrhage. 7. A patient with a history of Arnold-Chiari malformation type 2 presents with myelomeningocele. What is the main associated ventricular abnormality? A. Normal pressure hydrocephalus. B. Colloid cyst in the third ventricle. C. Non-communicating hydrocephalus. D. Ventriculomegaly due to cortical atrophy. Correct answer, C. Non-communicating hydrocephalus. Explanation. Arnold-Chiari type 2 malformation involves herniation of the cerebellar tonsils through the foramen magnum, often leading to aqueductal stenosis and hydrocephalus. 8. A 5-year-old boy presents with headaches, papilledema, and ataxia. MRI shows a mass in the fourth ventricle. What is the most likely diagnosis? A. Medulloblastoma. B. Ependymoma. C. Pilocytic astrocytoma, craniopharyngioma. Correct answer, B. Ependymoma. Explanation. Ependymomas are ventricular tumors arising from ependymal cells, frequently affecting the fourth ventricle in children, leading to obstructive hydrocephalus. 9. Which of the following is the correct pathway of CSF circulation? A. Lateral ventricles, cerebral aqueduct, third ventricle, fourth ventricle, subarachnoid space. B. Lateral ventricles, third ventricle, fourth ventricle, cerebral aqueduct, subarachnoid space. C. Lateral ventricles, third ventricle, cerebral aqueduct, fourth ventricle, subarachnoid space. D. Fourth ventricle, third ventricle, cerebral aqueduct, lateral ventricles, subarachnoid space. Correct answer. C. Lateral ventricles, third ventricle, cerebral aqueduct, fourth ventricle, subarachnoid space. Explanation. CSF flows from the lateral ventricles via foramen of Monro, third ventricle, cerebral aqueduct, fourth ventricle, subarachnoid space via foramina of Luschka and Magendie. 10. Which of the following conditions is most commonly associated with an enlarged third ventricle? A. Huntington's disease. B. Alzheimer's disease. C. Aqueductal stenosis. D. Hydrocephalus ex vacuo. Correct answer C. Aqueductal stenosis. Explanation. Aqueductal stenosis causes enlargement of the third and lateral ventricles due to blockage of CSF flow between the third and fourth ventricles. Summary of key concepts. 1. Obstructive hydrocephalus. Most common cause, aqueductal stenosis. 2. Normal pressure hydrocephalus, NPH. Affects lateral ventricles, causes gait issues, dementia, urinary incontinence. 3. Hypertensive hemorrhage, bleeding into ventricles from basal ganglia, thalamus, or pons. 4. Dandy Walker malformation, hypoplasia of cerebellar vermis, enlarged fourth ventricle. 5. CSF production by the choroid plexus. 6. CSF absorption by arachnoid granulations. 7. Arnold-Chiari type 2 malformation, herniated cerebellar tonsils, aqueductal stenosis. 8. Fourth ventricle tumor in children, most likely ependymoma. 9. CSF flow path, lateral ventricles, third cerebral aqueduct, fourth subarachnoid space. 10. Enlarged third ventricle, aqueductal stenosis. Would you like more case-based questions or explanations on neuroanatomy topics?